Right, coming to the MCQs, the fat embolism we'll do when we do lower limbs. Question number 1. A small child was playing with a maid when she rotated him by holding from the arms. Immediately after the child started crying, the arm was pronated. This is classically nursemaid's elbow or pulled elbow. Question number 2. History of Fuchs along with this X-ray. This is Galeazzi. Fracture of radius with damage to distal iliac joint. Patient, a known case of epilepsy, present with abnormal right shoulder with electric pulse sign. EE. So this is posterior dislocation. Bennett's fracture is a fracture of base of first metacarpal with dislocation of the carpal metacarpal joint. Absolutely correct. Which of the following fractures is seen in patient who fall over the flexed wrist? So when it's an extended wrist, it's Colles. Flexed wrist is Smith fracture. A person met with an accident, presented with extensive soft tissue damage, with comminuted fracture of bone with exposed bone without any vascular injury, classified according to Gustlow-Anderson. This is going to be type 3B. When the bone is exposed, 3B. If the comminuted fracture with bone not exposed, 3A. Earliest sign of compartment syndrome, pain on stretch. Earliest symptom is pain out of proportion to injury, not relieved by splintage or analgesia. Sign, stretch pain. What is the most common sequelae of shoulder dislocation? Again, a dislocation. Which of the following are indication of surgical management of fracture shaft humerus? Radial nerve involvement after manipulation, pathological fracture, vascular injury, multiple fractures. Age is not an indication. A patient with presented with a musculoskeletal complaint, the main aim is to differentiate articular versus non-articular. How will you do that? Remember, pain on active but not on passive is extra-articular. You are an intern, there is an upper limb fracture. Which priority will you give? The first thing I'll give is the vascular injury. That is the most important thing that I'll focus on. So on the priority, pelvic fracture, vascular injury, compartment syndrome, joint infection. So here there's a vascular injury, that's the number 1 priority. Most common bone to fracture on a Fuchs or a foreign outstretched hand is Colles, which is labeled by B here. Perilunate dislocation, the lunate stays, the other bone go out. True about fracture healing is, secondary healing does not have an intermediate cartilage stage or callus. It does, because in secondary there is a C. Primary healing will have intermediate cartilage stage. There is no C. So this is wrong, this is wrong. Micro movements help in callus formation. True. Macro movements do not help in fracture healing but will have intermediate cartilage. True. Both primary and secondary healing will have cartilage stage. Not true. So answer is C and D. This is a PGI type question. A female child with history of abuse has a fracture of pelvis, multiple injury, immediate step on presentation. Remember, it's ABC. So airway will be number 1. And if there would have been cervical spine stabilization, that would have been better. Surest sign of a fracture, abnormal mobility. A very, very common asked question. Posterior dislocation shoulder, Hill-Sachs lesion is, although it should have been reverse Hill-Sachs, but since they have mentioned posterior dislocation, anteromedial part. Dye is injected in the extremities. Patient has a pain in the upper limb. Paresthesias. Stretch pain. Go for fasciotomy. Most common site of fracture clavicle, middle 1/3. Most common complication of fracture scaphoid, non-union. It's not AVN, remember that. Fishtail deformity. This is a modification where the lower end of humerus, because of lateral condyle humerus fracture, loses the vascularity and appears like a fishtail seen in lateral condyle humerus fractures. A 35-year-old female presents with a history of fall in the bathroom. She was managed conservatively. She has a dinner fork deformity. This is due to extra-articular fracture along with a dorsal or posterior displacement. Identify the label structure. This is a radial head. This is capitulum. Very common around elbow. A child is unable to carry out the movements of pronation, supination, because there is fusion that you can see here. The radial head rotates around the ulna. 85% of movement of pronation, supination is controlled by the radial movement. When there is a fusion, there is no interosseous space over which these movements occur. So this is a case of radio-ulnar synostosis. So this is the most important section of trauma, the upper limb trauma. Thank you.